right. Hi, everyone. Good morning, good afternoon. I hope you can hear me well here from Bujumbura, Burundi. So I'm Juliette Bena. I'm a senior energy specialist in the energy and extractive global practice at the World Bank. I'm very pleased to moderate today's session under the Electrifying Africa, delivering on Mission 300 Faster Together learning series. Thank you all for joining us today. Today's session focuses on a critical but often underestimated dimension of electrification, which is maintenance and sustainability. As we work toward Mission 300, we increasingly recognize that connection is only the first step. The real challenge is ensuring that energy services remain reliable over time, especially for public facilities, such as health centers and schools, where electricity directly affects human development outcomes. So the SOLEIL program that we will discuss today in Burundi offers a compelling case study. It moves beyond installing solar system and seeks to institutionalize maintenance through technical design, cross-sector collaboration, and digital systems. So let me briefly introduce our today's speakers, and thank you for accepting the invitation. We will begin with opening remarks from Babacar Faye, World Bank Group Country Manager for Burundi. We will then hear from Chris Purcell and Stéphanie Nsom, both Senior Energy Access Consultant in the practice, with Stéphanie also being part of the SMAP Energy Access Expert Group, formerly Lighting Global. They will present the project context, achievement, and maintenance approach. Then Jean-Paul Wino, who is the director of Alliance Soleil, will share some lessons on embedding maintenance into the health performance-based financing, the PBF mechanism, and the importance of digital access. We will then welcome our colleague Syed Ghulam, Senior Health Specialist in the Health, Nutrition and Population Global Practice. Syed will discuss embedding maintenance into the health PBF mechanism, incentives, and early lessons. Lastly, we will welcome Mokhtar Ben Karijo Mahamadou, digital specialist in Digital Africa East, who will speak about cross-sector collaboration and the role of digital in public facilities electrifications. Following the presentation, we will open the floor for a moderated Q&A session. Before we begin, just a few housekeeping notes. Please keep your mic muted throughout the session. We encourage you to submit some questions in the chat. I will pose them as many as possible to the speakers during the Q&A session. And if time allows, we may also invite brief live follow-ups. So with that, it's my pleasure to hand over to Babacar for the opening remarks. Thank you.
Thank you. Thank you, Juliette. So given the very tight time constraint that we have, I'm going to try to be very fast, and so that we can hand it over to the presenters and get started. So I want to say good morning, good afternoon, good evening, in case somebody's on the other side, to everyone. And I'm delighted to be here. And I want to thank everybody for joining for this session under the Electrifying Africa Learning Series. So this is the first time I'm actually attending one of these sessions, so I'm very happy to be here. And I want to first really express our sincere appreciation to SMAP and the Electrifying Africa program for their continued technical and financial support to SOLEIL, and for really supporting Burundi not only in electrifying public facilities, but also in strengthening the institutional foundation that are required to sustain them over time. This partnership has been instrumental in moving from infrastructure delivery to systemic reform, and today's discussion goes to the heart of Mission 300 and the broader ambition of universal access because access only matters if it delivers reliable service, and it's not enough to connect the facility. Electricity must be available when medical staff need light for deliveries, when vaccines can be refrigerated, when laboratories and digital health systems are operating. And increasingly, we recognize that keeping the lights on is not sufficient. Electrification must also enable the use of essential biomedical equipment, such as examination labs that directly affect patient outcome. Electrification without maintenance does not deliver development impact. It creates stranded assets. Across many countries, systems are installed with momentum and good intention, but without the institutional backbone to maintain them. Batteries fail, spare parts are unavailable, responsibilities are fragmented, and within a few years, facilities are back in the dark or operating with unreliable power. That's a real risk. This challenge is even more acute in fragile and low-capacity environments where technical solutions alone are not enough. Fragile contexts require institutional solutions, clear rules, sustainable financing, trained technicians, spare part logistics, digital monitoring, and governance that outlast individual projects. Why Burundi matters? This is because Burundi is such an important case. Under SOLEIL, the program is scaling electrification to approximately 700 public facilities. But beyond the numbers, it is testing something more ambitious, a shift from project-based maintenance to a national maintenance architecture. This includes decentralized prevention capacity, national creative backbone, embedded maintenance financing, formalized cross-support collaboration across energy, health, and education, as well as digital systems to strengthen accountability and performance monitoring. In short, Burundi is testing whether maintenance and reliable energy services powering not only lights but essential equipment and digital systems can be institutionalized at national scale in a fragile context. What to listen for today? As you listen to the presentation, I invite you to focus on 3 dimensions: how maintenance was designed structurally from the outset, how it is being financed sustainably through sector systems and incentives, and how governance and digital tools enable accountability and scale. Burundi is not simply electrifying facilities. The real test is not installation today, but functionality 5 and 10 years from now. So we all look forward to the discussion and to the lessons this experience can offer for all other FCV contexts and for our collective M300 ambition. Thank you so much and look forward to the discussion again. Thank you. Over to you, Juliette. Thank you,
Babacar. So let's start with the presentation and from our speakers. Stephanie, please, over to you. Thank
you. Thank you very much, Juliette. Thank you, Babacar, for your excellent introduction, and good morning, good afternoon to all of you. I'm Chris Postal. I'm a senior energy access consultant working with energy extractors in the bank. Unfortunately, I don't have control over my camera. I apologize for that. So a quick contextual introduction. Burundi is a small, medium-sized landlocked country surrounded by the lake on one side. Can we go back to the other slide, please? Can we go back one slide, please? Yeah. Here's a picture of where we're working. I think it's important just to lay the groundwork. So it's a small to medium-sized landlocked country surrounded by the lake on one side, mountains to the north. The nearest port overland is Dar es Salaam. Population of about 14.7 million and a low 15% urbanization rate, resulting in one of the more densely populated rural areas in the world, reliant on agriculture and prone to poverty and electricity deficiency. Burundi is 187th out of 193 countries on the Human Development Index. Local job creation and employment is always a priority. As we've heard, Burundi is a fragile conflict and violence affected FCB country in a conflict affected area, and in fact still exposed to the DRC M23 conflict to the north. Grid electricity access rate in rural Burundi is below 11%, which hinders education, healthcare, investment, and economic growth. 17% of the population are served by decentralized off-grid technologies like lighting kits, while public infrastructure for all types is increasingly invested in solar plus batteries. The population experiences severe challenges with access to diesel and vehicle fuel. And on the other hand, the country is not very large, and rural regions are easily accessible as the main district roads over the hilly collines are well maintained. The map that you can see is showing 18 districts. As of 2025, political restructuring is reducing the number of provinces from 18 in the map to 5. While the current 42 communes or districts remain as functional nodes. So next slide, please. Okay, so this slide shows the health and education facilities by tier and ownership. The SOLEIL project intervention targets publicly owned facilities. The initial electrification objective was directed only at health. The target was the primary healthcare facilities, so the lower facilities, without grid or without solar. And you can see of that 670, the target was 361 sites. So the SOLEIL project would ensure that 100% of the facilities had some form of electricity. Due to the good progress on the procurement cycle, the ambition was expanded to education, where the numbers in need and the budget did not align, as 85% of rural primary schools are without power, amounting to around about 2,400 sites. Thus, the focus was limited to schools already prioritized under the World Bank supported school feeding program, and selecting central schools and their linked satellite schools. And this resulted in a total of about 346 schools in total falling within the ambit for the project. And the criteria for electrification in this schools pilot intends to maximize the potential benefits along the central and satellite administrative chain. Next slide, please. Next slide, please. Yeah, thank you. Okay, so the sustainability of public facility off-grid PV systems is a real challenge and is a legacy problem. There are typically well-known limitations within the public sector to conduct preventative operation and maintenance to a lesser degree, but more so for curative operation and maintenance, and especially to finance and manage component replacements timeously or at all, and to manage offshore component warranties. There are often many separate entities in this reporting chain, technical and financing chain, creating weaknesses. It's ideal to host these under one single responsibility, which can be most effective. For example, under a utility off-grid unit. And analyses from a current parallel project shows that this can be a least cost and robust compared to other options. Alternatively, it's widely being recognized that energy as a service options operated by the private sector could be most effective, provided that the corresponding financing, gearing, and risk mitigations can be leveraged. But these were not in place at our time. So in that context, this is what we've done, and these are the key pillars to achieve what we have. And the achievements and framing are in the top row for you to glance at while I elaborate below. So firstly, we focused on quality PV systems with increasing local company involvement in each procurement. So systems which do not become obsolete, but can be expanded as needs change and as energy demand grows. And this is a modular approach. We also looked at long-term component warranties supported in country, lithium-ion batteries specifically introduced. The project was also very fortunate to have an owner's engineer, highly skilled, to support the client in the design, procurement, commissioning procedures, and training. And our colleague, Jean-Paul Rino, will talk a little bit about this. I have to talk in detail about remote monitoring. So we targeted remote monitoring interventions for 100% of the sites. The logic behind the benefits of remote monitoring is intuitive. It enables system performance checking and tracking, resulting in shorter response times, time and cost savings in transport, and fuel savings. However, harnessing this for a large-scale off-grid program in a systematic manner has not been done, and much more work is required. And there are also issues arising in integrating this into the maintenance structure. SMAP, the World Bank's SMAP program, has been visionary in their early support. SMAP supported a pilot of remote monitoring for 150 sites to develop dashboard visualizations optimized for fleet management, not just for a few sites, which enables tracking of PV systems from multiple PV system suppliers on one unified dashboard to avoid the challenges which I'll mention now. Individual OEM monitoring platforms track individual sites very well, but are variously inflexible or cumbersome when you're looking to monitor larger fleets. Current OEM dashboards are very labor intensive when you look at more than one site for checking and reporting historical data. You had some lessons on cellular coverage. At least some OEM platforms require only intermittent 2G cellular network, while others require at least a permanent, reliable 2G network or better. And in the pilot, large data gaps were experienced. So cellular coverage had to be addressed as well in SOLEIL. And as a statistic, 21% of our sites did not even have 2G. 67 have 2G of an intermittent or reliable nature. 12% only with reliable 3G or soon to receive 3G. The project, importantly, has also reciprocally supported SMAP, granting access to online data for 150 sites for SMAP to develop KPI performance tracking and to develop pilot dashboards for energy as a service. And the testing of this has also proved to be robust and agile. And I'm sure you'll see a BBL soon from the SMAP colleagues in the near future. In fact, the Burundi SOLEIL will adapt KPI dashboard visualizations for long-term system performance tracking. And the benefit of this being early familiarization of these KPIs within Burundi, and which also paves the way for energy as a service for some future rollouts should the institutional setup for those be in place. So I've gone into some detail on remote monitoring, particularly as we won't really talk about that in detail again. Cross-sectoral collaboration will be spoken about a lot, so let me just highlight a few key areas of engagement. The development partners engagement, those partners with long-term presence and active in health and in energy and health are Enable, UNICEF, EU, and GIZ NDEV as well. So this engagement is principally structured around the long-term funding of the health sector, the biomedical and operation and maintenance support. In this case, the district health structure, which everyone who's involved with health in sub-Saharan Africa will recognize as core, and the district maintenance centers or DMC. So this development partner engagement takes lessons from the current operations and provides additional financial and technical capacity to the district maintenance center and adds a national maintenance center to fulfill these roles. And my energy colleague Stephanie will discuss how this has worked. On the energy and health nexus, the PBF or performance-based financing of the primary healthcare sector, Burundi is a leader in implementation of this financing approach, and it's crucial to understanding the available financing and financial constraints in the long-term sustainability. Besides for the remote monitoring needs, Burundi's Ministry of Health Digitalization Division is active and further promoting development of health management information systems, district health information systems, etc., other digital health initiatives, shifting away from paper-based reporting. And so this informed our final decision to bring at least 3G connectivity to every solar electrified health center, both because it's needed for health digitalization rollout, but also that the data subscription costs are likely affordable and sustainable because of this, even where low orbit digital satellite might be needed. and our esteemed colleagues from World Bank Health colleagues, Saeed and Olivier, will share insights onto that. So onto the connectivity, digital connectivity coordination within Burundi. So the rollout of at least 3G to all health centers and 2G to all schools requires an integrated approach to this digital connectivity. I mean, there are definitely cost savings, and the planning certainly improved via our engagement by overlaying the knowledge and timeframes from our respective sectors. But perhaps the main point to make is that we should have got to this earlier at the start of the project to enable better rollout coordination. And our colleague Mapta will talk through that engagement process. Finally, GIZ NDEV, we're incredibly grateful for your foresight and support to improve the connectivity. GIZ NDEV provided an additional financing grant to support this, to enable us to reach 100% remote platform coverage and enable an enhanced movement towards performance KPIs. There will certainly be many lessons learned from this endeavor as we move to the next 2 years of the project under the additional financing. Next slide, please. Yeah. So in concluding, we expect to have electrified 100% of the primary healthcare facilities, which will either be grid connected or solar connected. And those with solar, we expect to have 100% digital connectivity as well. Solar PV and battery is now mainstream, I would say, in Burundi, even for grid-connected hospitals, oxygen plants. Rollout continues even for grid-connected sites under World Bank, UNICEF, and UNDP funding. And I would say there's room for innovative business model opportunities here. And on the schools, more than 2,000 schools will remain for the future following this pilot undertaken by SOLEIL, and there's, I think, opportunity for flexible business models under the framework which we've put in place. So thank you for your time, and I look forward to the interactions following our team's input. Next slide, please. I'll hand over now to my colleague Stephanie, who will talk about the details of the maintenance approach and how the project has integrated capacity and finances together. But thank you very much. Over to you.
Thank you, Chris, and good morning and good afternoon, everyone. So I will speak about SOLEIL's maintenance approach, and I will start doing so by sharing with you the philosophy behind SOLEIL, what basically happened to the team when we first came to Burundi. So this was in January 2019, when we started the discussions with government on what would become later the first ever energy access project in the country. So as a consequence of that, we knew that we would have to build and implement a completely new project implementation unit in an FCV context. And at the same time, we wanted to target hundreds of public facilities, a scale that was never attempted before in the country. And in addition to that was that management back then in 2019 provided guidance to us and said, if you design this project, you need to seriously work towards maintenance and sustainability. Next, please. One before Anais, please. So in order to make maintenance sustainable, we basically, in our discussions with counterparts and partners and stakeholders, we basically looked at what already existed in the other sectors, health and education. We were looking for mechanisms and incentives that we could leverage to work seriously towards sustainability. And so what we did is we looked into the institutions, the incentives, as I just mentioned, and into the existing capacity. And basically everything that followed from those very initial discussions in 2019 was to leverage the existing and to build on that foundation. Next, please. Thank you. So in terms of governance, and certainly everybody who's connected today knows that electrifying public institutions is not just an energy project, it is absolutely cross-sectoral. And therefore, in order to establish a governance structure which would help us to make the intervention sustainable, we did the following activities. The first one is we integrated representatives from the health and education ministries into the technical and steering committees of SOLEIL Nyakiriza. Then we included health and education experts into the newly established project implementation unit and have them until today lead the respective components on health electrification and education electrification. And we also, especially in the first years of the project, we included a health expert into the World Bank Energy team. And in addition to that, always maintained very close relations with our colleagues from health and education. In addition to that project structure, we worked with the ministries and encouraged them to set up memorandums of understanding, trying to work towards a clear separation of roles when it comes to the installation of the infrastructure, but also, of course, to the maintenance and to avoid fragmentation. And those MOUs led to the appointment of focal points through whom we work and who basically facilitate and grow the dialogue between energy, health, and education. And last, Chris mentioned the very close and strong donor collaboration. We worked since day one closely with our colleagues from the Belgian Development Agency with Enabel, who had done an impressive work on integrating first elements around biomedical maintenance into the institution and into the incentives on the health side. So basically from day one, and I will talk about it a bit more, you will hear me saying Enabel here and there, because we really saw the opportunity there to plug in onto the biomedical maintenance, our maintenance for the solar PV infrastructure that SOLEIL is financing. Another aspect is the technical expertise. So as I mentioned, the project implementation unit was completely new. So we decided to provide additional expertise. Chris mentioned owners engineers, basically two companies who would work with the project implementation unit to improve the quality of work, to improve efficiency and speed of our interventions. Because again, our target was to electrify hundreds of public facilities. And I really think, looking back now over the last years that we have all been involved, I think this is one of the key learnings for me to really provide this additional expertise to the project implementation unit and not to save on that aspect. And the two owners engineers, one of them is Alliance Soleil, Jean-Paul, who will speak after me, and the other owners engineer or team, the supervision firm, is TTA. Next, please. Thank you. So now, in order to make maintenance sustainable, financing is critical. As energy experts, when we traveled first to Burundi in 2019, we did not know about the health PBF mechanism. PBF stands for performance-based financing mechanism. And what we learned back then about the mechanism is that the PBF in Burundi stands out, is strong compared to other health PBFs that exist in other countries and programs. And Syed and Olivier will shed some light on those aspects, so I will not touch on those. So what we said is we would leverage the PBF and plug in the solar PV maintenance, but also the maintenance for the other infrastructures that SOLEIL is financing. So the project agreed to inject an initial amount to the PBF for maintenance, with the idea that once we are all under the project are gone and the project is closed, this PBF maintenance idea will basically survive, and the integrated indicators, the strengthened verification will survive beyond our project intervention. So briefly, the injection into the PBF follows two streams. On one side, you have the BDS, which is the office of the sanitary district, where you will find the maintenance technician, where you will find the maintenance technician's workspace with tools, with motorbike, with equipment. And on the other hand, you find, of course, the health facilities where our solar PV systems sit. So the injection will go to a big chunk of it, 80% roughly we estimated, those percentages can change, will go to the health facility, into a bank account at the health facility that's called compte médicament. And there, the health facility will use a smaller percentage for ongoing maintenance and for preventive maintenance, for purchasing bulbs, basically the regular day-to-day preventive maintenance for which they will require those funds. Then you have a so-called replacement fund for long-term component replacements. And here we will, the Ministry of Health will instruct the health facilities to start saving. And the idea is that those savings will not be touched until the 2-year O&M period and the 5-year warranty periods are over. So this is really for future expenses for those bigger components. So that's one stream. The other stream, as I mentioned, is going to the BDS. And here, basically, the project will finance the motorbikes, repair, the insurance, will ensure that the workspaces from the maintenance technicians are being looked after. If any repairs need to happen, the BDS can use this funding for those clearly laid out eligible expenses. And the BBF, what also convinced us was the verification structure that exists. So we have designed, let's say, a maintenance verification form, which will basically be used to really ensure that the funding that we inject into the PBF will go towards maintenance activities. Next, please. So we spoke about governance and financing, and of course this needs to be matched with operational capacity. And we started mentioning a few aspects here. So we have developed, as you can see in the slides or in the picture that I'm sharing with you, a two-layered approach. So on the bottom, you will find a more decentralized layer where you will find the maintenance technicians, where the project has rehabilitated and equipped their workspaces. The Atelier de Maintenance has provided the tools, the spare parts, the motorbikes to really make this layer operational. And at the same time, because here it's the layer of the preventive maintenance, at the same time, additional, more engineering-like skills are needed to perform curative maintenance. And this represents the backbone of this setup, which is the National Maintenance Center. The National Maintenance Center will become the supervising entity for the entire fleet of hundreds of public facilities through remote monitoring and performance reporting. It will oversee the remote monitoring platform. It will manage the spare parts, the long-term warranties. It will handle complex diagnostics. It will take the advanced engineering decisions if a system needs to be expanded, if the grid arrives. And over time, hopefully, it will become a strategic institution that will significantly contribute to the overall maintenance setup in the countries for public facilities, health and education. Next, please. So I wish to close my intervention with this slide because I think we can develop over many years the most elaborate maintenance architecture on paper, but none of it works or will get done if it wasn't for the people who are committed and passionate about that topic. And also without the continued support that we have been receiving from 2019 to date from ESMAP. So with this in mind, and again, with my appreciation really for all the colleagues and partners who are connected today and who are involved in Nyakiriza SOLEIL, thank you very much. And with this, I would like to hand over to Jean-Paul and Marie from Alliance SOLEIL, who will speak about the technical aspects. And their title of today's presentation is the Standardized Modular System Design for Scalable Public Facilities Implementation, Designing for Today and Upgrading for Tomorrow. Over to you, Jean-Paul. Merci, and merci.
Jean-Paul, 5 minutes, over to you.
Yes, thank you all. Good morning to everybody. I'll try to be concise. I'm a technical advisor with Marie Charlot, and I have 3 slides to present to you. So thank you for this is the right one. The global strategy was based on 4 components. First, the systems were designed with a modular approach. The key components of the systems are the same regardless of the size, energy consumption, or destination of the system, whether it's a health facility or a school. I repeat, the key components are the same: PV module, hybrid inverters and battery blocks, and also main electrical cabinets. This modularity was designed from the beginning and incorporated into the tender documents. This required a thorough knowledge of existing modern, durable equipment available worldwide, for example, lithium-ion batteries. And it needed and it required that human resources capacity building was part of the project, which is the case. Second, the bidders for each tender were asked to provide the services for all the activities, namely procurement of the equipment, installation, a 2-year maintenance program, and the training of system users and local maintenance technicians. This method encouraged successful bidders to supply and install quality systems as they were subsequently responsible for ensuring the continuity of energy supply for the users. Third, quality insurance mechanisms were put in place at every stage. This was built in at the earliest phase and included in the tender document. For example, potential bidders knew they would be required to produce a sample system in the capital Bujumbura, then a pilot system at a project site before the full installation phase could start. The systems were tested to the required standards. Quality insurance included, among other things, detailed installation and commissioning procedures, review of all technical training materials before the training session began, and the training, it included the training of PV system trainers by a PV training specialist. All of this to ensure quality. Finally, a data management strategy was put in place. A shared folder was designed and implemented to facilitate overall project management. It allows for the collection of field data for each site, namely photos before and after installation, details of all equipment installed, and costing, implementation drawings, load demands, inspection, acceptation, and maintenance report. Next slide, please. Next slide, please. Thank you. The procurement strategy was phased in a way to test first the market, second to encourage local companies to bid, and then to speed up the installation of systems using more and more local companies, ensuring inherent local capacity buildings. The results have been positive, as indicated on the slides that goes from red, slow, orange starts to go, and green, rollout. The strategy was ambitious. Maybe we were lucky, but it was successful. The initial tender evaluation was carried out by UCP with technical assistance from Alliance SOLEIL during an on-site mission to Bujumbura. This allowed for needed maintenance assistance when tender evaluation was underway. Therefore, the tender training evaluation was done on a real practical case. Consequently, the following tender evaluations only required backstopping from us and were much faster. The UCP people were much faster. Finally, as the phases passed by, the speed of system installation increased by threefold, from 9 to 14 sites per month up to 35 to 40 sites per month. Next slide, please. Next slide. Next slide. Thank you. Technical assistance all the way. This project is very particular for that. The project benefited from technical assistance from the very start, at the tender document elaboration, at the system design, phase planning, in fact, all the way through the project. And for example, at the end of the project, we are coming to the end of the project. There was the harmonizing and increasing the quality of training materials for maintenance technicians in the areas of electricity, photovoltaics, and biomedical equipment maintenance. All aspects of the project received necessary and beneficial technical assistance, as shown on the list on the slide. To ensure capacity building of all other actors, all the quality insurance documents and procedures were discussed with UCP. They were not imposed, I insist. They were discussed with UCP, but also the private companies who were the successful bidders, and also with a supervision firm. For example, the commissioning procedures development was a collective work initiated and driven by us, but shared, improved, field tested with rigor with all the stakeholders, and then finalized and implemented without discussion. Finally, and I would like to insist on that a little bit, like Stephanie said, we must not forget that UCP management and staff were always, I insist, always responsive and acting for the good of the project, hence making full use of the available technical assistance. Next slide, please. This slide is just for you to have more information about the timing. For you to understand this slide later on, I just want to mention that phase can you go back? Phase A and B are the health facilities and phase C are the schools. Thank you very much for your attention.
Thank you, Jean-Paul. Sayed, Olivier, over to you.
Thank you, Juliette. Good morning and good evening, colleagues. I would like to highlight how Burundi's performance-based financing, as we call it PBF, provides powerful platform to ensure the investment of solar system and digitalization translates into sustained improvements in health services. Performance-based financing, or PBF, is essentially a strategic financing mechanism where the payments of the health workers and health facilities are linked to their performance, both quality and quantity of services, and the payments are done directly to the account of health facilities. So there is substantial autonomy for health providers to use these resources. And the system also has a very rigorous monitoring and evaluation system in terms of verification and validation of the results. Burundi has more than 15 years of experience of PBF, which is one of the oldest in Africa. All of the health facilities in the country, more than 1,000, are covered through this mechanism. And basically in Burundi, the PBF is financing free healthcare for maternal and child health services. One of the important features of the PBF in Burundi is the ownership of the government. 50% of financing of PBF comes from the government, and it's key for the sustainability of the model. PBF also contributes almost 50% of the operation cost of health services in the facilities that I mentioned, and also is an important chunk of the income of health workers comes from the PBF. Therefore, the existing platform of PBF is an ideal vehicle for sustaining the investment in infrastructure, including solar system and digitalization. As we speak, 361 health facilities, they have basically benefited from solar system, which is, as Stephanie mentioned, the health facilities, they are normally connected to the grid, but there are frequent outages. So the solar system provides a good backup mechanism. An important challenge, though, in terms of investment infrastructure, especially in the FCV countries, is the maintenance, operational maintenance, and which is a weak link for sustainability. But here, with the support of SOLEIL Nyakiriza, we have really focused on the maintenance, to establish the capacity for maintenance, but also to sustain it. As it was mentioned, all of the district health districts, they have now, thanks to the project, have a maintenance workshop with a trained technician, with equipment and logistic support, which is basically integrated in the PBF mechanism, with specific indicators basically defined for the maintenance, which basically is verified on a 6-monthly basis. And the health facilities, they receive resources for the maintenance and for the operation. These workshops, they also cater for the needs of maintenance of solar system for the schools. And also, as it was mentioned, the technicians, they are also ensuring the maintenance of other biomedical equipments. The linkage of maintenance with the PBF basically creates an accountability mechanism which provides the health facilities both with the resources and the motivation to keep the equipment functional, which is basically key for the sustainability. At this point, the BPF for maintenance is financed through the project SOLEIL Nyakiriza, but the idea is to basically transition it to the national PBF as the project is going to close. In addition, the Ministry of Public Health is in the process of connecting all the health facilities to internet. All of the hospitals, they're connected, but for the health centers, the process is kind of progressive. And with the SOLEIL Nyakiriza, all of the health facilities who have benefited from the solar system will also benefit from internet connection. Basically, that enables the health system to do remote monitoring of both equipments and services. Therefore, it improves transparency and efficiency of the system. So with that, I would like to hand over to Mokhtar, our expert on digitalization, to elaborate on the digital aspect. Thank you. I hope I was within 5 minutes or 4 minutes.
Thank you, Sayed. Mokhtar, over to you.
Hello, everyone. I will go very quickly to present the collaboration energy and digital teams had under the SOLEIL project to provide joint electrification and digital connectivity to schools and health centers. So given that there is a digital project in Burundi, ongoing digital project, which has activities related to the expansion of broadband coverage, we try to find potential synergies between these two projects. So we look at the mapping, so the schools and health centers to be electrified and provide a digital connectivity on one side, and the sites, the broadband coverage sites, the digital project intend to deploy. So we did this overlay of maps to try to see if the activities related to the expansion of the coverage fit with the requirement of the SOLEIL project. So this was the first thing we look at, and then we also look at the procurement approach for the connectivity, the digital connectivity as a service, how it's going to be procured under the SOLEIL project. So when doing this exercise, we had two issues that we overcame. The first was the mismatch between the timelines between the SOLEIL project, which has to deliver very quickly, and the PAFN project, which is going to deliver a bit later. So we cannot benefit from what the PAFN project is going to bring in terms of broadband coverage. So this was the first issue we faced. The second one was related to the procurement. So contracts were already signed with energy companies. It would have been more interesting to have Tesco's, telecom, and energy companies so that they can provide both services efficiently. However, we tried to find a way to realize some economy of scale in this the delivery of digital connectivity. So we tried to see how we can aggregate the demand for sites that are close to each other and make a better use of the resources available. So the lesson learned in this collaboration is that we should have started as early as the project design so that we can factor in each sector's timeline, and we can have a better sequencing of activities, and also inform the design of each sector's best practices. So I'll stop there, and if there is any question, I stay ready to answer. Thank you.
Thanks a lot, Mokhtar, and thank you to all our speakers for very rich and complementary presentation. So what we've heard today is not simply a story about installing solar system in public facilities. It's also about designing an ecosystem around those installations. an ecosystem which combines technical design, institutional clarity, financing mechanism, and digital governance. We can maybe take one question. Some colleagues answered some questions online directly in the chat because we are running out of time. So I don't know if there is someone who wants to ask a question live. If not, hopefully you got your answers through the. Oh, I see one question from Kenta. Go ahead, Kenta.
Thank you. Can you hear me?
Yeah, we can hear you.
Okay. Can you see me?
We can't see you.
Okay. Oh, there we go.
But go
Apologies.
ahead. Yeah.
So first of all, thank you very much. It's an extremely insightful presentation. I really enjoyed and learning a lot. And congratulations to the team for the achievement, but also very strong cross-sectoral collaboration with health, education, and the digital team. My name is Kenta Usui, Senior Energy Specialist from SMAP, and I also want to thank the Burundi team for collaboration on the piloting the remote monitoring platform, which we have worked closely with the Burundi team. So thank you so much. I have some questions. I can list 5 questions, but due to the time, let me just focus on one that is around the PBF, performance-based finance mechanism in the health sector, which I think that's actually extremely interesting because the constant challenge we see is that the bank finance is always finite and limited and time bound. And so the question is what happens next? And I think the SOLEIL project very much try to use existing government's program, the PBF program, to incorporate the maintenance needs in the future beyond the project closing. However, there's some sort of mechanics that I wanted to understand better, because the idea the PBF is a government's sort of financing mechanism in the health sector. And I think Stephanie mentioned that the project injected some financing to the program. And so I want to understand, does that mean the energy project has somehow made the money available to the PBF system in the health sector to be available beyond the project closing? Because that typically has financial management implications. And I want to understand that better, how that worked. And also, I want to have a clarity, is the health operation in the Burundi is also chipping in the finance to the PBF? And also, how long does it last? What's the level of sustainability of the PBF in a longer term beyond the project closing? Thank you.
Thank you, Kenta. Stephanie, over to you quickly, and then I'll pass on to Syed. Thank you.
Okay, perfect. I think I will say what Syed might say. So the PBF, Kenta, the PBF basically receives funding from government, and roughly, and the other half comes from development partners. And the World Bank Health team and projects contribute also to the PBF. So basically, what we're doing now with the PBF is SOLEIL Nyakiriza becomes a kind of partner who contributes to it. And once SOLEIL is closed, the idea is with inserting maintenance into the PBF, that then the general budget will carry that forward.
Syed?
Yeah, I think what Stephanie says, just to say that the current bank finance project is human capital development, and also have the Mercy project. They are financing PBF, and they are closing 2029. So basically, it will be taken over by the national PBF mechanism after the closure of the SOLEIL Nyakiriza, which is financed by the government and the partners.
Thank you, Syed. Colleagues and participants, we are available for questions after the event. If needed, feel free to reach out. It's already time, unfortunately, but I'll pass on over Babakar for the closing remarks.
Thank you, Juliette. And actually, before I read my remark, I have to say, I have to start with a confession, right? When you attend these meetings and you are the manager, you're following, you're supposed to know a lot of things. And actually, a lot of things that you guys said, I had no clue. I didn't understand. It's engineering jargon, but I know something. That this works, SOLEIL works. Why? How do I know that? Because this is the only project I have visited. I've been in my role for 6-7 months now, and I had a chance to go to Mutumba. So David and Juliette arranged it when one of our VP came here, and just hearing from the beneficiary and seeing, they explained the situation before, now, and going forward. It's amazing. So I do understand that everything that you're doing is working, although I didn't understand some of the engineering stuff, right? So I want to thank you all very much. And let me briefly highlight what makes the SOLEIL approach distinctive and where the real test lies. So SOLEIL moves beyond electrification as a project towards maintenance as a reform. It combines decentralized prevention maintenance with a national maintenance center as a curative backbone, anchors responsibility across energy, health, and education, embeds maintenance financing within the health PBF system, relies on a strong digital monitoring backbone, supports local market development, and invests in workplace capacity. Together, these elements shift sustainability from an aspiration to an institutional process. At the same time, there are some key risks that remain. The National Maintenance Center must become fully operational and sustainability funded. Financing for major replacements, especially batteries, must remain robust under strong government ownership. Maintenance financing in education lags behind health and needs further development. Cross-ministerial coordination requires constant effort and leadership, and long-term success depends on political continuity. Looking forward, the 2-year extension of SOLEIL through 2028 is a critical opportunity to consolidate institutions, strengthen financing, and address the vulnerabilities while the program is still active. So Burundi is not simply electrifying 700 facilities. It is testing whether maintenance and reliable service delivery can be institutionalized at national scale in a fragile context. The real measure of success will be functionality 5 and 10 years from now. So we invite everyone to continue this journey together with us as we share lessons and progress in the next phase. And I want to thank everybody who has contributed to organizing today's event. Juliette, David here, all the colleagues, and a big, big, big thank you to all the presenters. And this was really insightful for me. Again, didn't understand all the engineering jargons, but I learned a lot. And I hope everybody else also learned a lot. So thank you so much, everyone, and have a great evening, great rest of your day. Thank you.
Thanks everyone for joining, and we will share the presentation to the conference. Thank you. Have a good day.